Sarah, that was the best movie ever, right?
It was awesome, but Irina, I'm craving potato chips and a soda. Let's go back inside for a second. I want to go to the vending machine and buy some soda before we go for dinner. Is that okay?
Wait,
What?
why don't we buy a healthy meal?
Because I want soda and chips. So let's go get that and then we can go get your healthy meal. Let's go. Irina, I know you want me to get water, but I'm really craving soda. Which soda should I get? Do you want any? So like, cause I don't want the whole thing. I just want some of it.
No, you should get the water.
Nah, I'll get the Wild Cherry Pepsi C8. Thanks. Now we can go for dinner. Where do you want to go? I'm so thirsty. I can't breathe.
What's happening? Oh no! But you called 911!
Hi,
Hello.
I'm Ariella. I'm the nurse here at this hospital. Can I please have your name and date of birth?
Sarah Yakov, 9/25/1994.
Okay. And you are?
I'm her older sister. My name is Irina.
Okay, is it okay if she stays here?
Yes, it is.
Okay. How are you feeling?
I'm very annoyed. The doctor came in before and told me that I have something called diabetes and have no idea what that is, and my sister wasn't even here.
Can you please explain what that is?
Oh, of course. So diabetes is a disease that affects about millions of people every year.
Millions? Is there a cure?
No, there's no cure, but there is a treatment plan that is very successful. And after we're going to tell you, we're going to show you what happens in your body, and we'll show you how to take care of yourself.
But what is it?
Diabetes is a disease when your body has trouble controlling the level of glucose in the blood.
So is that a bad thing?
Well, yes, having too much or too little glucose in your blood can damage your heart, your blood vessels, your kidneys, your brain, your nerves, and it could even cause damaged eyesight.
So how does she control her glucose level?
So in some cases, people with diabetes, they take insulin and daily insulin shots, but sometimes you could treat it with diet and exercise. But I see that in your chart, your doctor has prescribed you Metformin.
Now, Sariella, I have a question for you.
Yeah.
What's that drug you said I have to take?
Oh, it's called Metformin.
Can you please tell me more about it? Because
Yeah.
I absolutely know nothing about it, and I want to know everything that goes into my stomach.
Of course. It's 2 o'clock and it's already time for your dose. I'm going to bring it over and then we'll go over it as I give it to you, okay?
Okay, thank you.
Okay. Okay, so I'm here to give you your dose of Metformin. Metformin is being prescribed to help control your blood glucose. With type 2 diabetes, your body is not able to use the energy from the food you're eating, so naturally your high glucose level would occur. Can I please have your name and date of birth?
Sure. Sarah Yakov, 9/25/1994.
Okay.
Can I ask you a question?
Yeah, of course.
Why is she taking this drug?
Okay, so Metformin is recommended as the first line treatment along with diet and physical activity, and it's the most commonly prescribed medications for individuals with type 2 diabetes.
Is there anything else we should know about it?
Yeah. Metformin, you have to take your medication every day as prescribed. You have to continue to watch what you eat, how much of it you eat.
Like what? What could I eat? What can I eat?
we're going to have a nurse educator come up and tell you all the different types of foods and what you can and what you should and what you shouldn't eat, what you should avoid.
Okay, thank you.
No problem. It's very good to increase your exercise while you're taking this drug.
I don't do that. I'm always sitting and studying. So.
Oh, you're a student?
Yeah.
You're going to have to check your blood glucose as directed by your health provider. And you have to be in charge of your diabetes. Staying active and being involved is very important with managing your type 2 diabetes.
Okay, I got that.
Can you please tell us more about the drug?
Yeah, of course. So you have to use it cautiously with alcohol. You cannot drink it or take it with any alcohol. You have to be careful with serious medical conditions like heart failure, myocardial infarctions. It's contraindicated with dehydration, so make sure that you're always taking it with water and food to prevent nausea and vomiting and an upset stomach. Hypoxia, that's another very important one. And also, you should be careful when you're pregnant and when you're breastfeeding. You should discontinue the use of this drug. There's many adverse side effects, which means it may occur, but it doesn't always occur. You can get diarrhea, you can get nausea, you can get vomiting, you can get abdominal bloating, you can have lactic acidosis, and you can have an unpleasant metallic taste in your mouth. What to expect. Your nausea and your other symptoms usually go away. You just need to continue eating healthy, perform physical activities. It may or may not improve your glucose levels. Just know that an upset stomach or other GI symptoms usually happens when you're starting metformin, such as cramping, nausea, gas, and diarrhea. It may take a few days for your blood levels to improve, and you may also be less hungry. I see that you're eating your lollipop.
I love lollipops.
That's great that you love lollipops, but you have type 2 diabetes, and it would be a better choice if you could avoid ultra sugary foods. Maybe an orange would be a better choice.
Okay, so you're saying this is going to make it worse?
It's one of the things that could make it worse, but the
Can you put an orange for me then? Okay, I appreciate it.
No, of course.
What else is good then, besides for the orange? Is she going to speak to me about it?
Yeah, she's going to speak to you about it. She's going to tell you everything about it, so you don't have to worry about that.
Lollies?
I know. Cut back on eating spicier high fat foods, and you may want to eat smaller, more frequent meals. That's usually a good idea. And just a couple of more things that I wanted to let you know before I administer it to you. I told you that it could cause a metallic taste in your mouth, and you should report the occurrence of any diarrhea, nausea, vomiting, and severe stomach pain to your healthcare professional if it's persistent. And also, there's a high risk of lactic acidosis and the potential need for discontinuation of the metformin therapy if there's a severe infection or if there's dehydration or a severe diarrhea. Then you must speak to your healthcare provider, and they're probably going to discontinue your metformin therapy. And the symptoms of lactic acidosis are chills, diarrhea, sleepiness, slow heartbeat or pulse, or weakness. And should you have any of these symptoms, you should come here immediately or call your healthcare provider. Oh, and one more thing. Do you take any off-the-counter medications, any herbs, any vitamins?
No,
No?
nothing that I know of. Everyone's doing take anything?
She's okay.
Okay, that's good. I'm just gonna administer your metformin.
It's just one pill?
No, it's actually, it's one pill, 500 milligrams, twice a day.
One morning, one night.
Yes, and you should take them when the doctor prescribes them. And if you miss a dose, you don't have to repeat the dose. Just wait till the next day. And keep in mind that it's important for you to take this medication with a meal. You ate your lunch, right?
Yes, I did.
Okay, so it's best to take it with water.
Okay.
Okay.
That's great.
Not that
Disgusting taste.
bad. Oh, okay. I'm sorry
You
about
warned
that.
me though, so I appreciate it.
Of course.
Okay, thank you so much for all your teaching.
Is there anything else any other questions that you may have?
My sister's gonna remind me to take the pill just because I tend to forget a lot. So.
Okay.
What's your adoption on your phone?
Okay.
Yeah, maybe just set an alarm on your phone, help you remind yourself.
My
Thank
sister will
you.
do that.
And the nurse educator will come.
Yeah, she's on her way up. She's gonna come. She's gonna explain to you all of the diet regulations that you
Thank
should
you.
and you should avoid. Okay.
Thank you so much for all
All
your
right.
help.
Anything else?
I'm good. Thank
All right.
you.
I'll see you guys soon.
Megan, I'm the nurse educator. What's your name and date of birth?
Hi, my name is Sarah. Date of birth 9/25/1994.
So I'm here today to answer any questions you might have about your medication, Metformin, and about diabetes. Can you tell me how you're feeling today and some information about Metformin?
I'm feeling much better than how I felt last week. I learned a lot about my medication actually. I know it helps to treat my diabetes type 2 and it controls my blood sugar levels. I take it twice a day, once in the morning with breakfast and once at night with dinner.
Yes, you prescribe 500 milligrams to take twice a day with your breakfast and dinner. If you have any severe symptoms of vomiting, diarrhea, abdominal pain, please contact your doctor and seek medical attention by going to your local ER.
I actually haven't had any of these symptoms.
Do you have any special diet considerations?
Yes, I keep kosher and I love cheese.
Okay. So we'll be making a referral for you to see a dietitian. Your diet is key in maintaining a healthy lifestyle with diabetes. There are also support groups, medication classes, and diabetes meetings in the hospital. Would you be interested in attending these meetings?
Yes, I would love to learn as much as I can about my medication and diabetes type 2.
Okay, so here's a calendar of these meetings that are done by hospital. I will also give you additional reputable websites that you could use for information.
Thank you.
It was nice to meet you, Sarah. I'm here if you have any questions, and here's my contact number.
Great. I will contact you if you have anything, and everyone here has been so helpful. I really feel less anxious about my new diagnosis of type 2 diabetes. Thank you.
All right, it was nice to meet you.